Hello and welcome to another part of your yoga anatomy, working on the spine tonight or today. I'm recording it tonight. So, yoga asana is a practice that requires us to move our body in ways that we don't do in everyday life. That's yoga. Some of these asanas can be extremely challenging for the body. As practitioners, we must be mindful and listen to our bodies to avoid injury. However, as teachers, we must protect our students from injury by understanding how asana moves the body, being clear on the right cues to give our students for correct alignment and safe transition through the poses, and being aware of how yoga may be affected by common conditions that you see as a teacher. You're often going to see things like hypermobility, hypermobile joints, scoliosis, lordosis, kyphosis, flat feet. We'll go through all those different conditions over a period of time, and these will be discussed in detail throughout the various modules. The spine, when we refer to the spine, we generally mean the spinal or vertebral column, pardon me, that we see all the way down here. And this is the central part of our bodies. It holds us upright. It carries the weight of our upper body and allows us to bend and twist and move around, as we need to do. And this spinal column looks after the spinal cord, which is a really important part of the body. Then this spinal cord carries messages from our brain to other parts of our body. The vertebral column is supported by ligaments, tendons, and muscles, which all serve to protect the spine and limits its range of movements. And we'll go through all those tendons and ligaments and how they work and how everything works together at a later stage. There are multiple bones that make up the spine, or the vertebrae, multiple vertebrae that make up the spine, and it's divided into 5 sections, as we've seen before. We've got the cervical spine, that's 7 bones, 7 vertebrae. The thoracic vertebrae, which is 12. Then there's the lumbar, 5, sacral, 5, and then 4 coccyx right down the bottom. And you often hear people saying they had an injury in T1 or T2 or C1 or S2. You'll find out all about these various injuries and ailments, and people come and they'll approach you as a teacher. And we'll discuss how we can make all this work for you, make it work for them, so it's a pleasant experience. Remember, don't be frightened when people approach you with these illnesses and ailments. We will help you to deal with those over the next year. Each vertebra is made up of the front part of the bone, which is made up of an oval disc and a hard bone enclosing spongy bone tissue. This is the part of the vertebrae that bears the weight. The vertebral arch, or the back part of the bone, is made up of bony protrusions which act as attachment sites for ligaments and muscles. And then there's a small hole is formed at the point where the vertebral body meets the vertebral arch, and this is where the spinal cord passes through the body. Okay, so you can see where the spinal canal goes down there, all the way through the body. Now, it's unlikely you will be approached by anybody to say that they've injured their pedicle or their superior articular facet joint or something like that. It's not going to happen, or it may, but highly unlikely. When we're looking and dealing with the spinal, the cervical spine in particular, remember the cervical spine, that is the top part. The first bone, that C1, is the atlas, and as I've mentioned possibly earlier, you would have seen one of my other videos, is that the atlas, can you visualize Atlas holding the world on his shoulders? That's the first one. And then the second one, C2, is the axis. And we'll go all along to see which one's responsible for moving left and right, etc. So remember the atlas, top, axis, the second one, and as they go down. Don't worry if you don't get all this. It will all make sense as we work along through the course, and with the notes that we'll be giving you, it will all come together. And there's always opportunity to ask questions, even if you've got to email them to me or you've got to give them to Haley and Haley gives them to me. We will sort it out. We want you to ask as many questions as you want. Remember what we said, between each vertebrae there's an intervertebral disc. You can see these different colors over here and they go all the way through. And this is a cushiony fibrocartilaginous joint which allows slight movement between the vertebrae and act as a shock absorber for the spine. And each vertebral disc is made up of an annulus, and this is the hard outer layer, and this outer layer, as I said, is the hard one, and then there's a nucleus, and this is the soft center. And when we start talking about herniated discs and slip discs or herniated discs, this occurs when part of the intervertebral disc escapes through the crack in the annulus. Okay, we will work on more specifically on injuries as we go along. So we know that the spinal cord, the cervical spine, is made up of those 7 vertebrae at the top of the spine and the neck. It's curved slightly inwards and similarly to the lumbar spine towards the bottom. This section of the spine supports the following parts of the body: the diaphragm, the shoulders, the arms, the esophagus and the chest. Remember that whole top part of the body. Okay. The muscles around the cervical spine can be stretching through asanas that stretch the neck. Okay, there's a lot of movement that's going to take place, and the cervical spine should be protected by ensuring that it is kept either in a neutral position, okay, or it follows the curves of the rest of the spine in postures such as back bends. The head should never be dropped far back. So often you'll see on Instagram, you see these fantastic shots, but anatomically and biomechanically that is incorrect. But as you become more experienced as a yoga teacher, you'll be seeing what is happening and you'll be identifying, saying, well, that pose may look great, but it's not a very accurate pose. Okay, it's not a very accurate asana. The pose is wrong and lots can go wrong in this spine. You can see there that the cervical vertebrae, it's smaller, it's bean shaped. There's no costal facets for ribs. Remember, there's no ribs that come up of your neck over here. And the transverse foramen is unique to the cervical vertebrae. Space for the vertebral arteries and veins to actually go down. And you got your spinous process. If you feel yourself at the back, you can feel those little bumps that occur right there at the bottom of C7. You'll feel that little bump over there. The transverse processes are small and have transverse foramen. Okay, you can see over there as it goes down, we're about to go on to it just comes to an end, and at the top you can see where the cervical spine ends and where the thoracic spine starts. 12 vertebrae. You can see on the left what they look like. Really actually solid, big, strong bones. They work really hard. And often in yoga, these bones, the thoracic spine, will be referred to as the upper back. And it's made up of the next 12 vertebrae after the cervical spine. It curves slightly outward, it's got that curve outward and is connected to the rib cage. Okay, you can see the ribs actually come out from the side of the spine. We'll talk about how they're connected in a later lecture. And these vertebrae are the large ones, and they're larger than the actual cervical spine. So the ones at the top were smaller and the lower down ones bigger, strong bones. The nerves of all the internal organs branch out of this part of the spine, and this section of the spine supports the following body: the arms, the esophagus, the trachea, the heart, lungs, liver, gallbladder, small intestine. You can imagine there's a lot going on inside this area. And when people have stiffness in the upper back, this affects the mobility of our spine and the mobility of our shoulders, how we move, and our breath. Limited flexibility in the thoracic spine leads to limited flexibility in the intercostal muscles of our ribs, which results in, with the limited movement problems you got over there. Okay, let me just get back on track over here. Poor posture and sitting at a desk all day can add to the stiffness in the thoracic spine and even cause accentuation of the curve in the spine. So you could become a little bit, you're sitting down with a bad posture, and I always have to remind myself to sit up straight. Even when I'm sitting teaching a class, I've got to be aware that I have a tendency to hunch down, sit up straight, get those muscles working, holding everything into place. When we're talking about limited flexibility in the thoracic spine and limited flexibility in the intercostal muscles of our ribs, which limits our lung capacity, bad posture, you can't breathe properly when you're down in that position. And we said that, that poor posture and sitting at a desk, we're so used to sitting at a desk all day, hunching down. It is easy over a computer. Okay. So from there, we see those bones are pretty big. They are medium-sized body, heart-shaped. They have costal facets for rib attachments on the body and transverse process. They've got long spinous processes which project inferiorly. We'll talk about inferior, posterior, and so forth as we go along. And they have medium-sized processes. Okay, lumbar spine, the next lot of bones, vertebrae, they come along. They can all be different shapes and sizes depending on your side. Mine are obviously going to be big. I'm a really big bloke. Mine are going to be big and strong. Yours might be different. They're all going to be strong. The lumbar spine, often referred to as the lower back. People are going to come to you, students, they can say, oh, Haley, anybody else? I've got a dodgy back. It often comes up, especially here in the UK. I've got a dodgy back. And this is made up of the next 5 vertebrae. It curves slightly inwards. Your lower back curves inwards slightly and is similar to the cervical spine from the neck. These vertebrae are the largest in the spinal column to support the weight of the torso. This section of the spine supports the following body parts. You can imagine the legs and the feet. Okay, like we said, it's the largest. They're round, oval-shaped. Spinous process is short, thick, blunt shape, projected posteriorly, and the transverse process is thick and blunt. So it's really strong and very, very supportive there. Okay. This is the part of back that is often associated with chronic back pain. I think I've mentioned that. And yoga has been proven as an effective treatment for lower back pain. Later on in the course, we will do some yoga for healthy lower backs. And there's a lot of research that's taken place to show how people with sore backs, stiff backs, back pain, how yoga can help them to feel much better. Postures such as forward folds that stretch out the lower back can help to relieve pain and improve flexibility in this area. When performing back bends, the lower back should be protected by pulling the abdomen towards the spine. Okay, as your yoga journey continues, we will work on this and we will reinforce lots of the things that I'm actually saying at the moment. Maybe take this opportunity, we're going to compare the vertebrae really, the cervical, thoracic and the lumbar. You can see the cervical at the top are smaller, the thoracic get a little bit bigger, and the lumbar are really big, strong, chunky. But remember, there's no ribs, there's nothing reinforcing them. They stand on their own. When you look at the skeleton, that little part down in the lumbar vertebrae, they are really strong and heavy going. We then move down to the sacrum and the coccyx, and the sacrum or sacral spine is a group of 5 fused vertebrae at the base of the spine. The coccyx or tailbone is made up of 3 to 5 fused bones attached to the sacrum. And like I said, when we're going to go into the yoga for healthy lower backs, we'll talk about the sacroiliac joint stabilizers and all the amazing things that will make your students feel so much better when they leave the class, or even for yourself when you are feeling a little bit sore. We will show you what can be done to help you and your students and family, friends, anybody who's working with you, to feel much better. So these bones, as the sacrum and the coccyx, they sit between the hip bone and form the back of the pelvis, and these parts of the spine support the following parts of the body: the bowel, the bladder, and sexual functionality. Okay, you can see the pictures over there, right where they are down the bottom, and there's a bit of a view from the front, and you can see the 5 fused sacrum vertebrae, and then the 4 fused coccyx down the bottom over there. Problems and pain from the sacrum and coccyx area can be caused by poor posture, sitting at a desk all day, and problems in the lumbar spine or injury. Okay, they all think you get lower pain, and it all goes down and it feels painful in the lower back, and sometimes it's not necessarily, the pain doesn't come from where it's felt, it could be a little bit high up, so it could be referred down. Okay, so we're talking about those forward bends and posture that require the spine to be neutral, can be healing and stretching. And sometimes you know yourself, and it's just, you bend forward and you fold forward, how much nicer that feels. You can see the variations of the sacrum, how many different shapes they can take. So we not all, remember, the body, each of our bodies are different. If we had to look at our skeletons, each and every single one of them are different. My hips open up very nice. As a child, I was a ballet dancer, and as a young adult, I skated and all that. So my hips open up nicely, whereas other people's hips don't open up, and we'll get into that detail when we talk about the other parts of the spine. Often we will talk about more further issues around the spine. You can see there's the sacrum from a different view, and before we end the lecture, we can talk about there's a few little common spinal conditions that will come up. In particular, there's something called kyphosis. Excuse my pronunciation, because wherever you are in the world, everybody pronounces it slightly different, but I think kyphosis is a safe way to go. And this condition causes an exaggerated rounding of the upper back. Even just talking about it makes me want to sit up straight. Okay. In more pronounced cases, it's often referred to as a hunchback when somebody's forward folded. And students with kyphosis should take into account the following. So be careful not to round the spine in a posture such as forward folds. And we're going to work through all these issues as we go along. And the back bends can reduce kyphosis over a period of time. So you can imagine if somebody's a bit of hunched over, doing those back bends can help. That doesn't mean they need to go and do wheels and so forth, because that's completely different. It may be a simple, a crescent lunge or a low lunge where they start tilting their back backwards. Okay. In standing asana, students with kyphosis must work to correct their natural posture, and again focusing on opening the chest, lots of opening, because we're so used to being slumped over things, keyboards, sitting forward, driving. So opening up the chest is amazing. The students who suffer from this condition, as they have this condition, the students should avoid modifying postures which place weight in the arms and the shoulders. Okay, asanas that flex round the spine intentionally should be avoided, and inversions must also be avoided. We'll go through some of these issues in more advanced, more detailed information at a later stage. Then you've got something called lordosis. This condition, exaggerated arching of the lower back, and students with lordosis should take into account the following. Okay, they must be careful not to overarch the lower back in back bends by focusing on bending from the middle of the back. Deep back bends should be avoided until the lordosis is reduced. In standing asanas, these students should tuck their tailbone slightly to avoid overarching. Okay, tuck the tailbone. And in the supine asanas, where you're lying on your back, students must press their lower back into the ground as much as possible. Okay. Forward folds help to stretch the muscles around the lower back, reducing lordosis over time. Okay, lot to take in, and there's going to be a lot more coming, but you're going to enjoy it, and you'll look back and say, I remember that when it comes up. And even if you don't remember all the detail, you'll be able to know that you heard about it, and you can go and you can read up on it and research it again yourself. Then there's scoliosis or scoliosis, whichever way you want to pronounce it. This condition causes a curvature in the spine, either in a C shape or an S shape as you go. And some students will actually happily show you their scoliosis, and it is actually a visible curvature of the spine. And the C shape, when looking from the back, the curves can occur in the thoracic spine. Remember the thoracic spine, the top, that's where you're going to find the spine. Okay, it can also occur in the lumbar spine, or actually all the way through, or both. It's often noticeable, except in severe cases. It is often not noticeable. So sometimes you'll think, oh, you suffer from scoliosis, I don't see anything. But when the case is severe, it is really severe. And these students should avoid deep back bends, but otherwise can have a normal yoga practice, which will help them to reduce their scoliosis over time. Side plank is especially beneficial for those with this condition. Okay. Common cues around the spine. In yoga, we generally want to keep the spine in a neutral position. And you know how the neutral position of your spine, you can see it goes slightly over the thoracic vertebrae, comes down into the lumbar, nice curve over there. And you generally want to keep the spine in a nice neutral position, create flexion, rounding, or create extension, moving the spine up and backwards. Okay, you can visualize, moving it up and backwards. Below are some common cues. I'm going to give them to you. You're going to get these notes if you haven't got them already, and cues to safely guide your students in practicing in a way that protects their spine. And it's usually tuck your tailbone pelvis. In a standing posture, this is generally a cue to stand naturally, but avoid arching the lower back, as many people do when they stand straight. Okay, I'm just doing it now, just thinking about it. So be all neutral. Shoulders away from the ears. This helps to create length in the cervical spine. Often people are hunched up. They might do warrior, and you can say relax those shoulders so that they shoulders away from the ears. This helps to create length in the cervical spine and relax the muscles around that part of the spine. As we teach, and when you break down the various asanas, you'll see what I mean, and you think, I remember that. That works. The other one, engage the core, or pull the abdomen to the spine. This asks students to engage the abdominal muscles to allow the spine muscles to become more flexible. This is often used when movement is required in the spine. For example, back bends and twists. People will often say, open the chest. And this is an instruction to bend the upper back inwards. However, this wording is clearer and easier to understand. So when you say open the chest, it's easier than to say open the back, bend the upper back, inwards. I know what I mean, but it's better to open the chest. There, I know that has been a lot to take in. There are notes, and it's your first day, but this is the first step in your big journey, and we will be breaking down, as I may have mentioned earlier on in one of the other videos, we will be breaking down each of these poses step by step, each part of the actual skeletal system. We're going to really break it down. The bones, how the bones are made up, the muscles, the cartilage, the tendons, everything, how they work and how everything connects together. Really great working with you all, and look forward to hopefully meeting you sometime soon, if not in person, maybe over a Zoom or anything like that. Contact me. You've got my WhatsApp details, or contact me through Haley, or ask either of us a question anytime. We're here to help and make this journey an enjoyable and fun one. Thank you. Just getting another closer look from a different angle as it all goes down, looking nicely how it goes all the way down, nicely shaped. And something that will be quite common, people will come into your yoga class referring to themselves as having a little bit of back pain, non-specific back pain and dodgy back. So if you know a little bit about the anatomy and physiology of the back, you will be able to have a bit of a clearer understanding as to what they are experiencing. Just a slightly different view. Moving around to the front, you can see how everything is working and how it all attaches, going all the way down into the pelvis. See if I can get a closer picture. You can see the intravertebral discs and so forth.